Hello. Welcome back. It's nice to see some returning faces month after month. So thank you for coming again. I guess I just have a couple of announcements. If you have your cell phone, if you would take it out, if you know that it's not on silent, if you just put it into silent mode, that'd be awesome. And I guess that's all I have for announcements. So at this time, it's my pleasure to introduce to you, or some of you might already know him, the newest member of A&G Sibley and the hospital, Dr. Eggers. He does family medicine at the clinic, and he also does ER services at the hospital. So, Dr. Eggers.
Hey everyone, I'm Dr. Eggers, as Denise had mentioned, and I'm talking about stroke today, as you can see. So, we'll get started here. We'll start off with stroke definition and some statistics today. So what is a stroke? There's two different kinds of stroke, generally speaking. One is that involves blocked arteries. This is also called an ischemic stroke, is the more medical term for it. It's what generally happens is a blood clot or something that blocks flow to the brain. So here's a picture of what that looks like. It can be plaques, it could be cholesterol, it could be an actual blood clot, but as you can see here, it's not exactly a completely open blood vessel. The other kind is a ruptured or broken artery. This is also called a hemorrhagic stroke. This is when a blood vessel breaks open in the brain. So before, you could see how the inside here was kind of clogged up. In this situation, something breaks off on the outside here and blood goes outside of the blood vessel where we don't want it. Some stroke statistics. More than 795,000 people in the US have a stroke every year. For 610,000 of those people, it's the first stroke they've had, which is about 3/4 of the cases. Every 40 seconds, someone in the US has a stroke. And every 3 minutes and 14 seconds, someone dies of a stroke.
Wow.
About 87% of strokes are the blocked artery or ischemic strokes, like we saw on the first slide. And stroke-related costs in the US were $56.5 billion in 2018 to 19. And that includes things such as the cost of services, the medicines, and missed days of work. Moving on to the next slide here, this kind of gives you an overview of what stroke cases per 100,000 people looks like in the US. So obviously, when we're talking about this area up here by New York City, there's a lot more people there than there are in the South, or by us in Iowa, in the Midwest, or even over in California. When we look at Iowa, here we are up here, and here's our cases down here. And again, this is per 100,000 people. We do not have that many people in Osceola County, or most of Iowa, obviously. So it helps put it on a bigger scale to compare counties to each other. You can see us here, we're a little bit darker shade, which is not quite as good. Areas up here like by Sioux City, Mason City, over by Iowa City, Des Moines, they tend to be a little bit lower, but clearly as a region up here in the Northwest, we're not doing quite as bad as southern Iowa. Next we'll move on to more of the signs and symptoms of stroke. So some of these signs include confusion, difficulty understanding speech, or trouble speaking. It can be vision changes. This could be one eye or both eyes. Sometimes it can be a severe headache. People will often say, this is the worst headache I've ever had in my whole life. It's way different than what they usually are. This is usually a sign of a hemorrhagic stroke, the less likely stroke cause versus the blocked artery one. Numbness or weakness, especially on one side of the body, can be a sign too. You often see this in the face, leg, or the arm. The big important part of this is it's not symmetric. Again, one side of the body. And balance trouble can be another one. This can include dizziness or loss of balance. So all of these are listed as signs of stroke. Just because you have one of these doesn't automatically mean you have a stroke. But there are a number of other diseases that have overlapping signs too, and that's why it's important to come and see us if you think that this is going on. So we'll talk about some ways to identify stroke next. One is the face, like we mentioned before. Oftentimes I tell people to try and smile, and one side droop.
Oh, yeah.
So you can see here, if I can get my, here we go. See on the right side, she can't really get anything to move, versus here on the left side, you can see she has some crinkling or movement by her eye, like she's trying to smile. You can see the corner of her mouth here too, trying to move. And again, the symmetric part is the big thing here. If both sides look like this, maybe they're just always crabby, or maybe that's just the way they are. But when it's one side, that's more of a problem. Arms is next. Have someone try and raise both their arms, and does one side drift downward? The other one can be if you have someone squeeze your fingers, is it the same strength on both sides? So here's what I'm talking about with one arm drifting downward. You can see here on the left, generally is what I would ask someone to do when they come in to see me in the emergency department, and it's equal. But here on the right side, you can see that his right arm starts going a little bit lower. And oftentimes you can see that arm just kind of move down, and that's a sign that things are not going well. Next, we'll talk about what to do if you are suspecting someone has a stroke, and that's the big one right there. Call the ER. We do an evaluation to see if you're having a stroke. Time is really, really important in these situations, mostly because some of the medicines we give for stroke are time dependent. Oftentimes it's within 4.5 hours of last known well time is what I mentioned there in all caps for one. Sometimes people will come in the morning and say, hey, my husband or wife woke up this morning and things don't seem right. And it's not just from the time they woke up, but if you didn't talk to them overnight or didn't notice it overnight, I go back to when they were last known to be well, which would have been when they went to bed that night. Some of the treatment recently has progressed where we can do more surgeries to take out some of these clots in some situations. And 24 hours sometimes is what's used as the cutoff for if they'll do surgery or not. Ideally, though, we want you to come in much sooner if possible. One of the common questions is, do certain parts of your brain control certain parts of your body? And the answer is yes on that. So here's a look at the brain itself. You can see we have frontal lobe, the parietal lobe is more on the top and the side, the temporal lobe is behind your ear, the occipital lobe is the very back, the cerebellum is more towards the back and bottom, and then that feeds into your spinal cord. Generally speaking, the anterior or forward part of your brain, so that's right here, controls the lower parts of your body, like your leg, and higher level thinking. The middle part, which is these two parts here, deal with language, hearing, also deals with memory and control and sensation in your arms. The back or posterior part here deals more with vision and balance. Balance is especially down here in the cerebellum. And the brainstem, which is down here, controls things like your heart rate and things that you don't really have to think about, like digestion, other things related to that. Another kind of fun picture, this is called the homunculus, which is homunculate to some people. Some of you have seen me in clinic if we're talking about pain, especially on your face or in your hands or in your feet. There's larger parts of your brain that are controlling things like your face and your hands versus things like your elbow or your hip. So this often can help us decide where a stroke is happening too, not only front to back wise in your brain, but side to side across. So next we'll talk about some causes of stroke. First one we'll talk about is high blood pressure. The definition often depends on who you ask. Some of the criteria is 140 for the first number over 90 for the second number. Sometimes we use 130 over 80, and some people use 150 over 90. I thought this was interesting. Half of men have a blood pressure over 130 over 80 or take blood pressure meds. And 4/5 of men that have high blood pressure aren't under control whether they're taking medication or not. 2/5 of women have blood pressure over that range or take meds, and about 1/4 of them aren't under control. So, does this point the picture that women are more compliant? Probably. Women are also at higher risk of having high blood pressure if they had high blood pressure during pregnancy as well. So if any of you had what's called gestational hypertension or preeclampsia when you were pregnant in the past, that certainly can put you at higher risk. Here's what your blood vessels look like if you do have high blood pressure. So this is what we like them to be. If you think back to the first slide, we want as much blood flow to get through as we can. Pre-hypertension would be anywhere between 120 and 140 for that first number. And you can see that it's a little bit more narrow here than it was here. And when you have hypertension, it gets even narrower yet. We want to keep this as open as we can, and that helps prevent us from having problems later on. A couple other causes of stroke here, being overweight or obese. 3/4 of men in the US are obese, which is a BMI of greater than 30. That depends on your height and your weight. Inactivity is a big one. Exercise is really big for that. Help prevent other problems. Diabetes can be a cause of stroke all by itself, and usually people who have diabetes have trouble with the other categories we've talked about as well. Alcohol is another one that can be a cause of stroke or help cause stroke. This would be averaging more than 2 drinks per day on average if you're a male, and more than 1 drink per day on average if you're a female. Some other causes of stroke: high cholesterol, smoking, and also family history. So before, we had kind of talked about with these blood vessels, when they narrow because of your high blood pressure makes these walls thicker, that prevents blood flow from getting through, and it makes it even worse when you have things like cholesterol plaques building in your arteries, because as you can see, that makes it narrow too. So thinking about these walls coming in and then having something in the middle just makes it even more difficult to keep those blood vessels open. Heart disease can also cause stroke. Blood vessels in your heart can be affected by that. Also, irregular heartbeat can cause blocks too, or clots I should say, that then break off from your heart and go through your blood vessels up to your brain. This is one that we can't fix very well. Age. Your chance of having a stroke doubles every 10 years after age 55.
Oh my gosh.
And this isn't just a straight line when we talk about doubling. If, for example, you have a 2% risk of having a stroke at age 65, that means you would have a 4% chance at 65, an 8% chance at 75, and then we're already up over 15% by the time you're 85. Acute treatment of stroke. So if this is what you have going on, these are the things we do in the ER and try and get you to Sioux Falls. Clot busters is one of the things we can use. This is if it's a blocked artery, not one that is where the artery broke open and you have blood going everywhere. And this is the important thing, like we said before, the last known well time was less than 4.5 hours ago. If this is 6 hours after you start having symptoms, we can't give you this medicine. Blood thinners are used. This includes aspirin. It's one of the more common medications everyone in this room probably knows about. Like I mentioned before, we can do surgery sometimes. That's not my call. That just depends on what specifically might be going on. Cholesterol medicine is often given. Sometimes blood pressure medicine, if your blood pressure is really, really high, we're talking like 180 to 200 for the first number, and lots of therapy. Stroke outcomes can be really difficult to predict at times, even when we know where the stroke is happening. The estimated 30-day fatality rate, so death rate after the first ischemic stroke, which is the blocked artery, is 16 to 23%, which is not insignificant. The inability for people to move their limbs or have problems thinking is as high as 40 to 50% of people who have a stroke. Problems with vision, speaking, or sensation is noted in 15 to 20% of people. Some of the common disabilities we see after 6 months after you have a stroke include things like depression, needing help walking, communicating, whether it's hearing or trying to speak or understanding speech, and incontinence. 25% of people who experience these things end up in a nursing home. This is a little bit skewed, and I don't love this all that much. Oftentimes, people who end up having a stroke are retired and no longer employed, at least full-time. The proportion of people returning to paid employment after half a year to a year is about 50%. So again, that's not maybe the greatest stat. We do something when you come into the ER. Have you do a whole bunch of tests when you're there. This is the NIH stroke scale. It's things like holding your arms up like this, testing your balance, all of those different things. If your score is less than 6 after doing all those weird exam things, you usually have a pretty good recovery, which means living independently at home or going to work if you still are working. If your score is at or over 16, it's a pretty high probability that you will either die or your life is going to be severely affected moving forward. The excellent outcomes, which would be living independently, for example, if your score is in the middle of that, is about 23%. Generally speaking, the bigger stroke that you have means worse outcomes, especially if it's one of the bigger arteries of your brain. And we use lots of therapy, whether it's physical therapy, occupational therapy, or speech therapy for some people to help get your function back. You also have worse outcomes the longer the symptoms happen, so please come in early if you think any of these things are happening to you. We're going to change gears here a little bit now that we've talked about how bad strokes are and no one really wants to have one. We'll talk about how to prevent you from having one. So first thing that we talked about was high blood pressure. So different ways to treat high blood pressure. Notice how I didn't put medication up here first. Diet is very good to try and get better. The DASH diet tends to be the best, and I'll have a picture of that in a slide coming up. It's hard for people to stick to a specific diet otherwise. I like to mention moderation to my patients, that this doesn't mean that you can't have a piece of cake or drink a pop once in a while, just don't do it quite as much. Exercise is really, really important for a number of reasons for your health, especially to help prevent stroke. I know I have listed up here at least 30 minutes for 5 days a week, and that's minimum. Please do more than that if you can. I would also recommend doing some kind of muscle strengthening for at least 2 days a week. Medication, that's the third one. I'm not sure, I lost a couple things here, but alcohol is another thing. Less than 2 drinks per day for a male or 1 for a woman that we mentioned before, and smoking helps or it makes your blood pressure worse. Here's the DASH diet that we talked about before. So here on the left are things that are more recommended in that diet. Here you see fruits and vegetables right away. Things like whole grains, which again doesn't mean you can't eat any bread, but more whole grains is better. Fish, chicken, beans, nuts, oil. Over here on this side, I'm not one that would say you shouldn't eat any red meat. especially if it's things like ground beef or comes from people around this area. What tends to be worse are things like jerky or things that are really preserved that have a lot of salt in them. Full fat dairy I'm less concerned about too, but these three on the bottom are the big ones. If you're gonna drink pop, drink diet pop. Try to limit the sweets some, and then obviously don't put salt in your food. A lot of our food has a lot of salt in it that we're not aware of, which you can check on labels, but especially adding more salt to your food is not good. I use a risk calculator to help decide whether or not we should put someone on medicine if their cholesterol is high. This is used to estimate your risk of having a heart attack or a stroke in the next 10 years. If the number is over 7.5, I generally recommend that we do cholesterol medicine. If it's between 5 and 7.5, we talk about it. If it's under 5, I usually don't recommend doing cholesterol medicine. This scale is used for people between 40 and 75 years old. So it wouldn't probably apply to everyone in this room, but if you are in that age range, I go through this with you. And notice here how it doesn't just mean my cholesterol's okay, I don't need to be on cholesterol medicine, or vice versa. Here I look at age, which affects it, like we mentioned before, diabetes, your gender, whether or not you smoke, what your cholesterol is, what your blood pressure is, and if you're on medicine for your blood pressure. Smoking is a big one for not just stroke, but many other bad health outcomes. There's a lot of ways we can help you stop other than trying to stop cold turkey. Chantix is one of the more common medicines we use. Oftentimes, if people don't like being on this medicine, they say they get really bad dreams from it. If that's the case, we have other things we can try too. There's nicotine replacement, whether it's patches or gum. There's a medicine called Wellbutrin or bupropion, which is also used as a psychiatric medication. This does not necessarily mean you have psych problems if you're on this. I know people don't like being on psychiatric medication because it can make them cause weight gain, but this is one of the medicines that affects your weight least of all of those medicines too. And generally, if you're going to be on one of these medicines, we recommend treating you for at least 3 months. There have been some studies that have shown that being on for at least a year helps keep people away from smoking even more successfully than just 3 months. And just because you need medication or want medication to help you out doesn't mean that you are weak by any means, because stopping smoking is probably one of the hardest things anyone can do. So we're happy to help you with that. Heart disease was one of the ones we mentioned earlier that can cause stroke. Diet and exercise, medicine can help with that. How to treat age. Whoever finds out will be very good. Mini strokes is something I get questions on sometimes too. So what's the difference between a mini stroke and an actual stroke? The symptoms are really similar. They usually go away on their own and generally within an hour of them starting. This little acronym can help us determine what your future stroke risk would be. 6 to 7 points puts you at high risk, 4 to 5 points is a moderate risk, and 0 to 3 points is a low risk. So anywhere in that scale, you'd have a 2 to 90 day risk of anywhere from 1% on the low risk end to 18% on the high risk end, depending on what that looks like. So here's the ABCD2. Age of over 60, high blood pressure. One-sided weakness gets you 2 points. Problems talking. If your symptoms last longer than an hour, that also gives you 2 points. If your symptoms are 10 to 60 minutes, that's just 1 point. And also diabetes. Aspirin is something to mention now. We don't recommend taking aspirin if you haven't had a stroke before to prevent having a stroke. If you have had a stroke, then we do recommend it. This would be something to talk about with your doctor about whether or not you should be on aspirin if you think you may have had a mini stroke. So that's something to talk about in the ER, in clinic. So something to consider. It's important to have conversations with your doctor about advance directives and living wills. We don't know what your outcome is always going to be if you come in with a stroke, and it's hard to have some of these conversations when someone is not doing well. I'm going to talk more about advance directives and living wills for those of you who'd like more information on that when I do my next Lunch and Learn. Here's some of the resources that I used. Any questions from anybody?
I had a mini stroke about 10 years ago,
Mhm.
and this side here is 100% black. So I was just watching this now,
Okay.
so I don't know what the. I went through baby aspirins today.
Okay. I just keep following what your doctor's telling you to do. One of the tests that we do if someone's having a stroke can help us see if these blood vessels are clogged up. So that's something that we do if we suspect someone's having a stroke too. So that's good to bring up.
Can you explain AFib and stroke? I don't know if maybe Dennis and I didn't hear it, but maybe it's part of it.
Yes, so AFib and stroke. AFib can be something that certainly causes stroke, especially if you're not on any blood thinners. What happens in AFib is your heart doesn't beat at a normal pace anymore. Instead of doing a constant beat, it beats and then maybe skips and then is just not regular. What happens with that is your blood is used to going through all of your stuff at a similar speed, and when your heart isn't beating at a regular beat, the blood flow gets stopped and then goes and stops and goes, and that can cause a blood clot in your heart. That blood clot in your heart can then become dislodged and go through your vessels and get stuck in your brain at times. So if you have AFib, oftentimes we recommend you be on medicine. If you're someone that falls a lot, then we talk about what's the thing we least want to deal with, you falling and bleeding or you having a stroke.
In what way does excess sodium cause a problem?
So the salt helps contribute to those blood vessels getting narrower that we talked about early on, and having a lot of that salt makes those blood vessels narrower. Yeah.
How many months after having a stroke is your best chance of a full recovery? Like, you do a lot of physical OT after having a stroke, but would you say like in a year after is your best chance of recovery, or is there a certain time frame?
It certainly depends on what blood vessels affected in your brain. Some take a little bit longer than others. If it's a larger area that's affected, that makes a difference too. Oftentimes I see on CT reports in people's brains that a lot of people have what's called small vessel ischemic disease, which means the very small blood vessels in your brain are narrowed, which we see in a lot of people. I don't really have a good answer for you as far as how long it takes. It's very personal dependent, I guess.
If you've had a heart attack, what are the chances of you having a stroke?
Pretty high, because a lot of the things about the vessels of your heart also pertain to the vessels of your brain too. You could probably talk a lot about this with heart attack with the same stuff I talked about. It's just that the symptoms are in a different area, but a lot of similar causes.
you, Dr. Eggers. That was a great
So along with that, if you think you guys are having a stroke, be fast. We made you bookmarks to help you guys remember the warning signs for stroke. Thank you guys all for coming, and we look forward to seeing you next time.
Thank you. Thank you, thank you. Thank you.